Germany is considering classifying Britain as a virus variant area with new travel restrictions today, despite its own health minister bracing for a massive fifth wave. The German government is expected to make a decision within hours, which could mean all travelers from Britain would have to quarantine for 2 weeks, even if they are vaccinated. Germany has reimposed its own health restrictions following high case numbers due to Omicron, barring unvaccinated individuals from restaurants and non-essential commerce. Health Minister Karl Lauterbach today said the variant will lead to a huge wave of infections regardless of the new restrictions, saying even if the strain is milder, it may make no difference. He said, "We must prepare for a challenge that we have not yet had in this form." Were the virus to be less serious than other variants, this might keep deaths low for 2 to 3 weeks, before the growth of the virus would eat up this advantage, the minister said, underlining that a difficult period ahead was inevitable. Case numbers in Germany have declined slightly since the new restrictions, but the spread of the more infectious Omicron variant, first identified in South Africa, threatens to send new cases up again. Governments around the world are scrambling to speed up booster vaccination campaigns to increase individuals' protection against the highly mutated virus. But Germany remains short of millions of doses, as the country says it is going cap in hand to other nations, including Romania and Poland, for more shots. Lauterbach said the country now was racing to secure more vaccines to speed up its booster campaign that was at the center of its strategy against the new, highly infectious variant. Speaking on German television, a group of 3 experts echoed this, saying there was now no way to stop the coming Omicron wave sweeping Europe. Lauterbach said Germany was on schedule to receive just 1.2 million doses of the Pfizer/BioNTech next week, to distribute to vaccine centers and doctors' practices. A further 800,000 would be received the following week, and another 1.2 million the week after that, he said. The country also hoped to receive millions of booster shots adapted to the Omicron variant from BioNTech/Pfizer in the first quarter of next year. But this is far less than the amounts which doctors are asking for every week, he said in the dire warning, adding that Germany was reaching the end of its reserves. The campaign has to roll, but there is literally no more than this there, he said. In order to stock up on vaccines ahead of the inevitable wave, Lauterbach said German authorities were negotiating with Romania, Bulgaria, Poland and Portugal and seeking an emergency buyback of millions of unused doses from Eastern European nations. Prominent virologist Sandra Zizek warned that Omicron is unstoppable. She likened the country's preparation to running into a catastrophe with our eyes wide open. Most research on the variant has been carried out in South Africa, where the strain was originally detected, she said. It has so far suggested Omicron may not be as severe as the likes of Delta, but appears to be more transmissible. But CSEC, from the University Hospital Frankfurt, said this should not be taken for granted in Germany. We don't have systematic data for Germany yet, nor do we know how severe the diseases are, she said. The virologist spoke during a press conference alongside experts Dirk Brockmann and Christoph Neumann-Hefelen. The pandemic is repeating itself, they said, likening the spread of the variant to the first wave. At this stage, stopping Omicron is impossible, Brockmann, head of epidemiological modeling of infectious diseases at the Robert Koch Institute, added. Before becoming the health minister this month, epidemiologist Lauterbach was the health spokesman for the Social Democrat Party, which is now the largest part in Germany's ruling coalition after ousting Angela Merkel's Christian Democrats. He was also an active and much relied upon commentator on the pandemic. The health ministry confirmed reports that it planned to spend €2.2 billion on 80 million Pfizer doses through official European Union procurement channels. It is also looking to buy a further 12 million doses directly in order to start the new year in a sensible manner, it said. The Delta variant currently makes up around 90% of Germany's COVID cases. But Lothar Wieler, head of the Robert Koch Institute for Infectious Diseases, said that while there were currently only a few hundred Omicron cases in Germany, it was only a matter of time before it became the main strain. Meanwhile, the European Commission said it has reached an agreement with Moderna to rush deliveries of the U.S. company's COVID-19 vaccine to Germany and other European Union member states, as cases surge due to the Omicron variant.